The very first thing we see here on the screen is an image of the brain as seen from an inferior view, where we can see the cranial nerves emerging. This little pair of nerves highlighted in green here are what we're interested in today, as these are the two vagus nerves emerging from the brain. The vagus nerves are the 10th pair of cranial nerves, and it's the longest of the 12 pairs of cranial nerves. The name comes from the Latin and means the wandering nerve, which describes its wide distribution throughout the body, as we can see now on this image. It performs many important roles within the parasympathetic nervous system. This system is one of the two antagonistic systems making up the autonomic nervous system and is craniosacral, which means that it arises from the central nervous system in the cranium and from the sacral region. The vagus nerve actually carries 75% of the cranial parasympathetic function, so it's pretty vital for life. I also want to draw your attention to the picture here. We're viewing the body in through its left side, showing the vagus nerve highlighted in green, the structures it innervates along with their major arteries, and a few other structures to help orientate us. This is the view we'll be exploring in this tutorial. So let's start, and first we'll look at the general course of the vagus nerve. At the top of the picture here we have the cranial nerves leaving the medulla oblongata. The vagus nerve on each side passes anteriorly, then dives inferiorly to leave the skull through the jugular foramen. Through the foramen, it is accompanied by the glossopharyngeal nerve, which is the 9th cranial nerve, as well as the accessory nerve, which is the 11th cranial nerve. There are two sensory ganglia in each vagus nerve at the jugular foramen, which are the superior vagal ganglion and the inferior vagal ganglion. When the three nerves pass through the jugular foramen, they go their separate ways, and the vagus nerve continues down the neck within the carotid sheath. The vagus nerve on each side runs posterolateral to the carotid arteries and medial to the internal jugular vein, then passes in front of each subclavian artery. As the right and left vagus nerves approach the arch of the aorta, they branch to form the cardiac plexus, the pulmonary plexus, which isn't shown on our image but is located approximately here, the right recurrent laryngeal nerve, the left recurrent laryngeal nerve, and the esophageal plexus. The paths of the right and left vagus nerves differ as they prepare to form the esophageal plexus, so let's take a look at these differences right now. We're going to take a look at the right vagus nerve first. If we change the angle of our image, we are now looking from the front into the open chest cavity. We can see that after passing over the right subclavian artery, the right vagus nerve angles slightly medially to meet the esophagus at the level of the sternal angle. Here, the right vagus nerve spirals posteriorly around the esophagus, where it becomes the posterior vagal trunk, and contributes fibers to the esophageal plexus, highlighted here, and posterior gastric branch of the posterior vagal trunk. The right vagus nerve provides most of the fibers of the celiac plexus. This forms the celiac ganglia sitting on the front of the aorta, as you can see. This gives off the pancreatic plexus, then the splenic plexus, the renal plexus, the adrenal plexus, which we can't see in this illustration, the intestinal branch of the vagus nerve, and the intermesenteric plexus. It's useful to note that these branches leave the front of the aorta and then travel alongside of their organs' respective arteries. This is just one of many ways your body has evolved for efficiency. Now we'll move over to look at the left vagus nerve, which is highlighted in green on this image. And from here, it continues inferiorly before curving around the arch of the aorta to run onto the front of the esophagus esophagus. As with the right, this happens at the level of the sternal angle. When it meets the esophagus, it forms the anterior vagal trunk and contributes the rest of the esophageal plexus. Now let's take a closer look at the anterior vagal trunk. Switching here the highlight to show you the anterior vagal trunk, which is giving off the anterior gastric branch of the vagus nerve, highlighted here. The anterior vagal trunk then also gives off the hepatic branch of the vagus nerve, which in turn provides most of the nerve fibers to the hepatic plexus. An important structure to note at this point is the superior mesenteric ganglion, shown here. Although near the path of the vagus nerve, it does not actually contain vagus nerve fibers. In fact, it provides sympathetic innervation to the small intestine rather than parasympathetic.
If you found this quick anatomy or physiology video helpful, you'll enjoy our video tutorials even more. Click on the button and you'll see what I mean. We have hundreds of videos available to our premium members, not to mention all the fun quizzes, complete articles, and atlas sections to solidify your knowledge. Click on the button in the middle to watch the full-length video and master anatomy and physiology.